pain. Pain is something we've probably all experienced at some point in our lives, even in childhood, when you've fallen off a bicycle and you've gotten hurt, and everyone's quite familiar with it. So I think what pain really is a part that we'll go through quite quickly. Let's get to the next slide. This is what we're planning to cover: what pain actually is, the classifications of pain, what secondary pain is, what are the aspects of pain, factors that lead to pain, what the impact of pain is, which means what does it actually do in your life and how does it affect you. Then we're going to briefly talk about how pain medication actually works and what role we can expect our essential oils to help us with, and then some examples of which essential oils we use, and then we'll have a Q&A session. So I'm going to go quickly because there's a lot of information to cover. I think everyone's familiar with this. Pain is a sensory experience. When they talk about complex and subjective, they're saying that for everyone, it's going to be a different experience. Some people will have a more severe pain response, and some people will not feel it as much. And it's not that everyone's going to have the same experience. Pain can be extremely distressing and uncomfortable. And this is why it's something we would tend to want to fix when it happens, when you have an injury or when you're feeling it. And for arthritis, for example, a lot of people complain about that pain and they want to do something about it because it is impairing them. It is stopping them from living their lives in a happy, joyful manner. So pain does play a very important role in our daily lives, including a toothache. I had popcorn stuck in my tooth and it was so distressing and it started getting so painful that I had to do something about it. And I'll tell you later what I did about it, and it was pretty amazing what happened. So let's get to the classifications of pain. They are classified based on the duration. So you've got acute pain, which is sudden. It comes on very quickly and it is usually short-lived. So it's not very extended period of time. And you've got chronic pain, which is over a period of time. So something that you've been experiencing for years or, well, weeks also, 2 months to years, this would be chronic pain. Then you have the source of the pain. Nociceptive pain is arising from actual or potential tissue damage. So when you have a physical injury, when it's also activating specialized sensory nerves called nociceptors. So this includes somatic pain, which is from the skin, muscles, joints, and the visceral pain is from the internal organs. Neuropathic pain is caused by damage or dysfunction of the nervous system, which results in abnormal signaling. So that means you're getting incorrect information, and it's often described as burning pain or shooting pain or tingling pain. The location of the pain also is another way of classifying the pain. It's either confined to a specific area of the body, or it originates somewhere and it's radiating from that part of your body to other parts of your body. This is often along the nerve pathways. The character of the pain also is another way to classify it. So you've got, when doctors ask you to describe the kinds of pain that you're experiencing, they'll ask you if it's sharp or dull, or stabbing pain, burning, tingling, or numbness. So usually the sharp pain is intense and it's sudden, often indicating a tissue damage. Dull pain is an aching or throbbing sensation, which is typically less intense than the sharp pain. Stabbing pain, I'm sorry, I'm indicating that with a knife, but that's what it's usually like. It's really sharp. It's a piercing sensation. Burning pain feels like heat, or it's characteristic of a neuropathic pain. Tingling sensation, I think a lot of people may have heard of before. It's like when you have a nerve dysfunction, sometimes even sciatica, and you will feel that there's tingling, you know, the pins and needles that you would feel. Then you've got the function of the pain. Adaptive pain is when you are, say, for example, touching something really hot. You're cooking and the pan gets really hot and you touch it. That is when your body will say, okay, move away from that. And that is adaptive pain. So your body knows it's not good for you, takes you out of that, that particular environment. Maladaptive pain is when this persists beyond the expected healing time. So this is when it becomes chronic pain, and that is what we do not want. So it's important to have the adaptive pain because your body should know what is good for you and what isn't. Pain is not a bad thing. You just have to be mindful of managing it correctly, observing it, and checking it in time. Psychological pain is pain perceptions. They can be influenced by psychological factors like anxiety, depression, stress. These can amplify or modify the experience of pain. So a person's going through something, and a person who is depressed or is feeling anxious or is feeling nervous about something, the pain will simply seem much more than it would be otherwise. So let's get to the next slide. Secondary and referred pain. So sometimes you have a condition that's happening in one part of the body, but you're feeling pain and distress in another part of the body. For example, you could think about like the toothache that we spoke about a few minutes ago. So pain in your tooth could also result in you feeling pain in your head. So the surrounding areas like your jaw, your ear, your head, that's where you start feeling it. That is not necessarily a problem in the head, but it could be radiating from your tooth. Sorry, I'm just admitting people into the call as well. Referred pain occurs when pain is felt in a different location from the actual source of the problem. Sciatica is one of them, where there's compression in the spinal column, and the sciatic nerve is getting disturbed, and that causes pain in the lower back that's radiating down to the leg, often to the glutes, the thigh, and the calves as well. So with stomach pain, for example, this is another example of referred pain. The root cause could be gastritis, inflammation of the stomach lining. You could have peptic ulcers. You could have reflux disease. You could have IBS. You could have inflammatory bowel disease, Crohn's. You could have food poisoning. You may have gallbladder problems. So you could have parasites, but you get pain in the stomach. So it's very important that you get a proper diagnosis when you are experiencing pain, especially over a period of time. Another set that while studying this, I realized that there's a lot we don't consider when someone comes to us and says that they are experiencing pain. We can't go into their bodies and understand what they are going through. So it's important to listen to them and guide them through describing what their pain actually is. So pain is subjective. It's going to be different for everyone. It's multi-dimensional, which means your physical sensation can affect your mood, your behavior. You will suddenly react instead of responding. You'll start getting angry and irritable. You'll have mood swings. You can get anxious. You can get depressed because of it. It also serves a protective function, like we talked about earlier, the adaptive pain. And your body will tell you, okay, let's step away from this pain. It's not helping us, and save your body, protect yourself. And then, of course, you have the physiological basis, which when there's damage sort of in the tissue or in the nervous system. When injury occurs, there are specialized nerve endings called nociceptors. They detect noxious stimuli and transmit signals to the brain where the pain is processed, and then it's perceived, and then it's processed. And then the brain interprets these signals and generates a subjective experience of pain, which means your brain is what's telling you whether this is really intense or it's not. So while it can be really distressing and uncomfortable, pain does serve a very important function in the body. It is there to protect you and to tell you that something is wrong and you need to take care of it. So now let's have a look at 4 common causes of pain. The most popular one, of course, we've experienced when we were growing up, probably most of us, is physical pain. You fall off your bicycle, you are playing in the playground, someone pushes you, you get hurt, you get cuts, bruises, and all of these physical injuries and things. And of course, athletes, as they are working out and or they have an injury while they're performing, they can damage some tissues as well. People get fractures. These are all examples of the physical injuries that can result in pain. Then you've got the emotional pain, and I'll have to go through the slide quickly because I want to show you a very cool video. You've got the emotional pain, which is when you have undergone an emotional trauma and you start feeling distressed. You will probably start drinking less water. You're not going to hydrate enough. And this physically impacts your body, your cells' performance. Then you've got mental pain, where you're constantly thinking about stuff. You get exerted and overwhelmed with everything that's going on, overthinking, and you've got chronic fatigue as well. Now, when you have mental stress, now mental stress and chronic fatigue are very interesting because when you have mental stress, there's also muscle tension. It's not like it's only in the head. The brain is releasing cortisol and adrenaline into your system. Your body's going into fight or flight mode, and you're constantly releasing the stress hormones into your body. Your muscles get tense, and chronic muscle tension can contribute to the development of chronic tension headaches, migraines, and musculoskeletal pain disorders. You also end up having altered pain perception. When you have mental stress, the pain will seem much worse than it physically is. So stress can lower the body's pain threshold as well. So a lot of individuals become more sensitive to pain stimuli, and the perception of pain changes. It gets amplified. Inflammation is when chronic stress occurs in your body. So when chronic stress can trigger a cascade of physiological responses in the body, including the release of stress hormones, like we just talked about, like cortisol, and inflammatory cytokines. Prolonged exposure to these stress-related chemicals can contribute to systemic inflammation, which is associated with various pain conditions like arthritis, fibromyalgia, and in IBS. And this is all very serious stuff. But what I'm going to do is ask Abhi to show you one of the videos that I found, and I thought it's a very nice way of explaining what this does. So we'll just go quickly into some of the other factors like emotional distress. Mental stress is often accompanied by emotional distress, such as anxiety, depression, or feelings of helplessness. These emotional factors can aggravate the experience of pain by amplifying the feeling. So you're noticing a pattern here. The mental exhaustion on your body, the fatigue that you feel, and fatigue is something that you feel mentally, and then physically it's completely different. The mental fatigue that you feel is causing your body to get physically exhausted, and your system then says there's pain all of the time. So one of the most important things to take control of is your mental state. And that's what we're going to talk about when we look at some of the examples of what you can use. The impact of pain. So what happens when you're experiencing a lot of pain? It can impair your normal functioning. Chronic pain can actually affect your mobility. So your flexibility goes, you're disrupting your daily activities. You don't want to do anything because of the pain. And then your interest in everything just sort of changes. It affects your mood and emotions. It can cause feelings of frustration, irritability, hopelessness, negatively impacting your mental well-being and your emotional stability. It can disrupt your sleep as well. So, and that is really not good because that's what you need to recover. This then affects your social relationships. So when you start distancing yourself from everyone and everything because you're dealing with severe pain, you really need to do something about that pain. And often it also will affect the quality of your life. So even if you decide you don't want to meet anyone, you're okay with no sleep, you'll stop doing the things that you wanted to do because of the pain. Not you will, people do stop doing things. We have a lot of people who come to happiness and say they don't feel like going anywhere. They don't want to meet anyone or do anything because they are dealing with such severe pain. So now what do most people do? They usually take different kinds of pain meds. And this is what has been available to a lot of people, over-the-counter drugs, which are available at chemists. But there's something else that we can do, which is what we'll cover in the next slide. But before that, I'm going to ask Abhi to please play the video on the pain, please.
Yeah.
Thank you. Am I going too fast?
No. Can you
Come on,
see my
perfect.
screen?
You want me to do what?
Can you see my screen?
No.
No. Hello?
Do you want me to do this?
Can you see my screen?
No.
Can you stop sharing from your
Yes.
side?
Yes. Awesome.
You can see now, right?
Yes.
Okay. Can you hear the audio?
Yes.
Okay.
Let's say that it would take you 10 minutes to solve this puzzle. How long would it take if you received constant electric shocks to your hands? Longer, right? Because the pain would distract you from the task. Well, maybe not. It depends on how you handle pain. Some people are distracted by pain. It takes them longer to complete a task, and they do it less well. Other people use tasks to distract themselves from pain, and those people actually do the task faster and better when they're in pain than when they're not. Some people can just send their mind a wandering to distract themselves from pain. How can different people be subjected to the exact same painful stimulus and yet experience the pain so differently? And why does this matter? First of all, what is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is something we experience, so it's best measured by what you say it is. Pain has an intensity. You can describe it on a scale from 0, no pain, to 10, the most pain imaginable. But pain also has a character, like sharp, dull, burning, or aching. What exactly creates these perceptions of pain? Well, when you get hurt, special tissue damage sensing nerve cells, called nociceptors, fire and send signals to the spinal cord and then up to the brain. Processing work gets done by cells called neurons and glia. This is your gray matter. And brain superhighways carry information as electrical impulses from one area to another. This is your white matter. The superhighway that carries pain information from the spinal cord to the brain is our sensing pathway that ends in the cortex, the part of the brain that decides what to do with the pain signal. Another system of interconnected brain cells called the salience network decides what to pay attention to. Since pain can have serious consequences, the pain signal immediately activates the salience network. Now you're paying attention. The brain also responds to the pain and has to cope with these pain signals. So motor pathways are activated to take your hand off a hot stove, for example. But modulation networks are also activated that deliver endorphins and enkephalins, chemicals released when you're in pain or during extreme exercise, creating the runner's high. These chemical systems help regulate and reduce pain. All these networks and pathways work together to create your pain experience, to prevent further tissue damage, and help you to cope with pain. This system is similar for everyone, but the sensitivity and efficacy of these brain circuits determines how much you feel and cope with pain. This is why some people have greater pain than others, and why some develop chronic pain that does not respond to treatment, while others respond well. Variability in pain sensitivities is not so different than all kinds of variability in responses to other stimuli. Like how some people love roller coasters, but other people suffer from terrible motion sickness. Why does it matter that there is variability in our pain brain circuits? Well, there are many treatments for pain, targeting different systems. For mild pain, non-prescription medications can act on cells where the pain signals start. Other stronger pain medicines and anesthetics work by reducing the activity in pain sensing circuits, or boosting our coping system, or endorphins. Some people can cope with pain using methods that involve distraction, relaxation, meditation, yoga, or strategies that can be taught like cognitive behavioral therapy. For some people who suffer from severe chronic pain, that is, pain that doesn't go away months after their injury should have healed, none of the regular treatments work. Traditionally, medical science has been about testing treatments on large groups to determine what would help a majority of patients. But this has usually left out some who didn't benefit from the treatment or experienced side effects. Now, new treatments that directly stimulate or block certain pain-sensing, attention, or modulation networks are being developed, along with ways to tailor them to individual patients, using tools like magnetic resonance imaging to map brain pathways. Figuring out how your brain responds to pain is the key to finding the best treatment for you. That's true personalized medicine.
You can try this painting.
So I think that was a pretty awesome video. And what they said right at the very end is if you understand what is causing your pain, then you'll be able to identify what the right solution is for you. There is another video that we'll watch, but a little bit later, on how meds actually work. Maybe we won't need to watch that one. Let's go through what I'm personally using and a lot of people on this call are using, and those who are new to dōTERRA and all of these solutions, welcome to the world of natural remedies. And don't we love using some of these products? So let's have a look at some of the essential oils and some of the products that we like to use for pain. Why we are using these, and not just pain, to feel better and also to enable our bodies to heal itself. So we use our essential oils because we find them to be very effective. They work quite quickly. These are potent, pure extracts. These are not diluted. There's no adulteration. They're quite strong. So they're very effective. They work pretty fast. They are pure, potent. They're versatile. When you're using them, you'll find multiple positive benefits. So you may want to use, say, lavender for an insect bite, but it also helps you to relax, makes you feel good. It's called the oil of communication. So when you use it, you will tend to speak better and also communicate your message clearly. They are very convenient. They come in these little bottles, and the deep blue comes as a deep blue rub as well, and also comes as a deep blue stick, which we're hoping that dōTERRA India will bring back because everyone is waiting for that. It's also a holistic approach to solving your pain problems because you're not just addressing the physical symptoms, you're also addressing the root cause of it. They are very safe to use. All the safety regulations are shared with us, of course. The safe uses are shared with us, but also you can hardly go wrong with something like this. You also get used to it the more you practice, and they are wonderful even for infants. I use them on my pets, and if you use something on an animal, then you know it's going to be good for you. No negative side effects at all. So you can't go the other way with these. They're very safe to use. And they help you address the root cause of the problem. Let's look at some of them. I talked to you earlier about what happened with the popcorn getting stuck in my tooth. Now, clove is an old Indian remedy. And when you get a toothache or gum pain, we are asked to just put some clove in the mouth where the pain is and bite down on it. The only problem with that I used to find was I'd get blisters in the mouth because of the fiber of the clove, and it was quite unpleasant. So when the clove oil came out in India, I was really excited to try it because I didn't want to go to the dentist anymore. And all I did was take one drop of the clove oil when this popcorn was stuck in my gum. And I said, okay, let's give this a try and see what happens. And I was rubbing the clove oil in the gum, and believe it or not, that bit of popcorn that was stuck inside just came out. So I don't know what worked, whether it caused the inflamed gum to just shrink up a little bit or what, and that bit of popcorn came out. But it has been wonderful for my whole family. Everyone uses this one. So our dentist is not too thrilled, not seeing us that often. But we're really happy. You can even take a drop on your toothbrush with your toothpaste and brush your teeth with it. Though our dōTERRA toothpaste is also wonderful. We love that too. And for other kinds of pain as well, you can even use it when you have a sore throat. So just add a couple of drops into water and you can gargle and rinse your mouth with it and also gargle with it. let's have a look at a couple of the others as well. So Aroma Touch is probably my favorite oil. I carry it everywhere with me, and it's very relaxing. We do a hand massage treatment as well with it. So people who are at the computer a lot, you have carpal tunnel syndrome, you've got certain other issues with flexibility, your circulation needs to be improved. Aroma Touch is a wonderful blend, proprietary blend that has given a lot of people a lot of relief. We did have someone who came to Happiness now this was last year, and there was compression in the cervical vertebrae, and his wife was really distressed, and they said that they wanted to avert a surgery and they didn't know what to do for this pain. He was not able to feel any sensation in his left hand, and sometimes he would get a numb feeling and tingling like we talked about earlier, like the sciatic thing. So immediately my mind went to, it looks like there's been a whiplash and he has compression in the cervical vertebrae. So what would you typically do is increase the circulation there. So let's try Aroma Touch. And we put a couple of drops of Aroma Touch. I gave it to his wife and asked her to put it on his neck, and she did. And within 20 seconds, he started feeling more comfort in his left arm. They were quite thrilled with it. So I have seen some amazing results with Aroma Touch. So for physical discomfort, this is a long list of essential oils that you can use. I will be sharing a list with everybody else that's been prepared, especially for this subject on pain. And we'll share that in the chat window after it's done. But Aroma Touch, Deep Blue, Past Tense, amazing stories with Past Tense. Claricam, basil is now in India, by the way, and it is absolutely delicious. Bergamot, copaiba, a favorite with everybody. My doggies take it as well, especially when they're aging and they're dealing with, well, they stop running around as much as they used to, but copaiba is really helping them. Coriander is another one which unexpectedly was wonderful for pain. Frankincense, of course, the king of all. So a lot of these are wonderful for pain as well. And let's look at some of the emotional discomfort. Now, we didn't really talk about pain that comes from emotions, but when there's a loss of a loved one, you're grieving, you actually physically feel a sadness in your chest. And a lot of people have described this as something is sinking inside, and it's almost like you're not able to breathe very easily. So we've got some beautiful oils and blends that we use for these kinds of emotions as well. And a physical response that actually happened with Breathe. Again, I'll give you examples from what I have seen and witnessed myself. At my activity center, there was a class going on, and one of the students had an emotional release in that class. And when she came downstairs, she wasn't able to breathe. She was possibly grieving the loss of a loved one, and she felt like she was going to have a panic attack, and she was holding her chest down. And immediately I just asked her, what are you feeling? And she said she's not able to breathe, and she feels like everything is just pulling inwards. So I just gave her a couple of drops of Breathe and asked her to take a few drops, rub her hands together and inhale it. And she did. And she sat down and she looked at me and she said, "What did you give me?" So that got me thinking about how this is working. And I started exploring this more. And there you go. There's a lot of information available where you can use the essential oils for emotional discomfort and emotional pain as well. For mental discomfort and fatigue, when you're feeling completely exhausted, drained out at the end of the day, when you've been working nonstop and things are coming at you from everywhere and you don't know where to go first, you could use Adaptive that helps you focus and get the job done. So Adaptive is one that helps your body to relax, but enables you to get everything done. So it's not like putting you in a trance or making you sleepy or any of that, but it actually helps you to adapt to the situation that you are being presented with. And some of the others that you can use for fatigue, rosemary is a very popular one for fatigue, and it's wonderful for your hair as well. So let's take a look at some examples of pain which are characteristic of autoimmune conditions. So when you look at fatigue, person who's dealing with fatigue all of the time, when you're looking at joint pain and swelling, muscle weakness, swelling and inflammation, and nerve-related symptoms. Most people are not aware that autoimmune diseases are actually the ones that are affecting your nervous system, which can lead to symptoms as numbness and tingling and weakness in the system. So there are over 80 known autoimmune diseases, each of them affecting different parts of the body. And some of them include rheumatoid arthritis, which is a chronic inflammatory disorder that primarily affects the joints, causing pain, stiffness, swelling, and loss of function. And it can really, it depresses people. It's an awful thing for a person to have to go through. Type 1 diabetes as well. It's an autoimmune condition in which the immune system attacks and destroys insulin-producing cells in the pancreas. But that's not our subject today, so we're not going to talk about diabetes. But multiple sclerosis is another one in which the immune system attacks the protective myelin sheath that covers the nerve fibers in the brain and in the spinal cord, disrupting the communication between the brain and the rest of the body. So let's talk a bit about how autoimmune disease actually works. How does it even come up? It's when your system goes into an overdrive, when you're constantly exposing yourself to different kinds of stresses, and that stress does not leave the body and it sort of gets stuck over there. That is one of the reasons why people get autoimmune problems. So what do you do to get yourself out of it? After you've had an injury or you've dealt with the trauma, you need to do something to snap out of it. You know, when you get into chronic depression, this is one of the things that can cause your system to head in this direction. So if in case you have an autoimmune issue, these are the things that you can do to support your body. Eat an anti-inflammatory diet, which means avoid dairy if you can. Get good supplements into your system. Manage your stress correctly, which means do something, get some exercise, make sure you're getting good sleep, avoid drinking substances which you think are going to relax the body and they're actually going to cause damage to your liver. You want to have things which are good for you, which are uplifting for you. So you could take lemon essential oil, inhale it. You can take it internally as well. It's a very cheerful oil. It makes people really happy. Metapower can help support with your metabolism. Serenity can help you with getting better sleep, improving your sleep quality. Adaptive can help you with dealing with the stress. So whenever you're feeling a bit stressful, you just inhale some and you feel all happy. So things that you do to make yourself feel good, try and do those as well. It doesn't always have to be use essential oils, but I find these to be very convenient. I just carry them in my pocket. And if I'm feeling something where I need some support, I pull one out. And this is one of my favorite ones. It's always with me, not just to give myself a little hand massage, but also anybody else who needs a little bit of relaxation and a bit of circulation in their body. Claricalm has been a godsend to a lot of people when you're dealing with monthly cycles and the cramps that come in, along with the bloat and tummy distress. And you don't have to use this only during the monthly cycles. You should give this a try when you're feeling any sort of distress anywhere, in any muscular tension as well. This is worth a shot. Everyone should experiment with this one. Lavender is a very versatile one. So insect bites, any bumps you suddenly get on your skin. Lavender is a beautiful one for cell renewal as well. It's extremely soothing. It helps with the emotions. It will help to keep you very calm. And today I used it on my pet, not realizing that that's what he needed. And believe it or not, I put it on his paws. He had some cuts because we were walking out on the street and he got wounded out there. And I diluted the lavender, put it on his paws. And when I was massaging him, he was actually smiling. And it made me feel so good that he felt calm and relaxed. And of course, it also took care of the wounds on his paws. So that was really an amazing thing for me. Lemongrass is a beautiful one, which most people might not know, helps with connective tissue injury, joint, tendon, and ligament pain. So you can either create a blend or you can dilute it and apply it on the pain location itself. Past tense has been nothing short of magical for a lot of us. So often when I've made a video about this one, so I tend to use the swipe keypad, and I do also use my thumbs a lot on the mobile phone. And there was one evening in particular where it was getting really tight. and it was quite painful and I wasn't able to move the thumb. So I said, oops, this is going to be a problem. So I actually just took the past tense out and I rubbed it along my thumb and a little bit on my wrist. And again, within a few seconds, not even minutes, I was able to move my thumb easily. Another incident where I found past tense to be very handy. I used to keep ramming into furniture. And once when picking up some stuff, in fact, when Zareen had come to Pune, had gone to an art store to pick up some supplies like markers and things. Getting out of the car, I rammed my knee into, that little storage unit which is in the car in between the two seats. So I rammed my knee against that and it was really painful. And I went into the store, picked up the stuff, came back, and I'm holding this pain. And I had my past tense with me, rolled it on, and voila, within minutes, it was gone. So I was really happy. This is one of the favorites. It does have a strong aroma. So a lot of people like my mom don't like it, but I love this one. It's wonderful for tension, for head tension as well, and also stress in the shoulders and in the back. And the name literally indicates what you could be using it for. A lot of pain, which people hold in the neck and the shoulders, is because they're holding burden. And past tense is one that helps you relieve yourself of that sort of stress. Digest Sen is another beautiful one. When you have tummy distress and pain in the stomach, you just rub it on, and you can put it on your pulse points as well. It also helps to calm the nerves down. So when kids are going in for exams and they get really stressed and the tummy starts to gurgle and starts getting cramps and things, Digest Sen is a beautiful one that just relaxes everything and also can help to relieve that nervousness and anxiety because it has calmed down the tummy. Now, the vagus nerve, the reason I wrote that is because the vagus nerve is the first one when the embryo is formed. So, and it goes from the stomach to the brain. So the reason why people get loose motion sometimes when they are anxious or they're stressed about exams is because of this vagus nerve. It's connected directly. So when you get stressed up there, the stress goes to the stomach. And this is for most people, not for everyone. So you take care of the tummy and the brain at the same time, which is amazing. Fennel, surprisingly, is another one that I found to be wonderful for digestive distress as well, but also works on physical pain. But be careful, this one is quite strong, so you definitely want to dilute it before you use it. And especially for children, higher dilution ratio is highly recommended. This is another one I use for my doggies when they have a little bit of respiratory distress. Just take a couple of drops and put some fractionated coconut oil and rub your hands and then rub it along their spine and along the stomach and the chest. And it helps to clear up their airways. So it's really nice for them as well. So the last thing I wanted to talk about is co-impact sourcing with dōTERRA. One of the reasons we love these products is not just because they're so effective, they are convenient, they are pure, we are getting the best possible solutions in our hands. But the other end of the spectrum is the work that dōTERRA does with farmers. The people who are supplying these to us are actually getting the support from this company. They are partnering with local farmers. dōTERRA partners with local farmers to ensure that they are getting fair and on-time payments. So dōTERRA first makes sure that these guys are taken care of. And also the sourcing is done with where these plants grow in their natural habitat. The locals in that area are getting jobs, and they're also being supported, like in India, with hospitals. For the turmeric sourcing trip I believe everyone went on, there's a hospital that is being supported, which is providing free treatment to everyone who is in the village there. So in this way, I think dōTERRA is creating massive opportunity, not just for us, by enabling us to help ourselves. They're empowering us to take care of ourselves, to listen to our bodies, to reconnect with ourselves, to reconnect with nature. They are also taking care of the people who are creating these beautiful products for us, growing them, the people who are distilling them, of course, the bottling, the packaging, everything, every aspect of it, dōTERRA is directly involved in it. So we're really grateful to them that they've come to India. And life is supposed to be meaningful and fun. And what does that mean? If you have pain, now there's something you can do about it. And even with the autoimmune conditions, there's a lot you can do. I would suggest If you don't know where to get the essential oils, please reach out to your upline, the person who introduced you to this call, who asked you to join this call. And the reason I put this photo up here is because they are safe enough for our pets. They are safe enough for babies. They are safe for us. They are safe for seniors. And this is a lovely little blend that you can make if you do have a pet at home who is an older pet and a senior and needs a little bit of support. Just take some myrrh and helichrysum and copaiba, and I've done this with mine, and they are very happy with it. And the vet who saw them after that was pretty amazed with how well they responded to this instead of popping painkillers for them. So that's it. That's the end of the PPT slides. And